This video will cover the first portion of NATROX O₂ application, which is wound preparation. Although this video shows wound prep on a leg ulcer, the same steps will be taken to prepare all indicated wound types for treatment. To begin, gather the supplies needed and place them on a clean surface. For more information on supplies, see the Setup and Supplies video series. Remove the old dressing and discard it according to local guidelines. The wound should then be cleansed with normal saline or any preferred wound cleansing product. Pat dry. If appropriate, reduction of necrotic or thick sloughy tissue can be carried out prior to application of NATROX O₂ ODS so that the wound bed is approximately 80% clean. Peri-wound protection should be considered to prevent potential maceration from the increased exudate due to the introduction of oxygen to a chronic wound. A non-petroleum-based barrier film or cream may be used. The wound should never be covered with petroleum-based products as they prevent oxygen from reaching the wound. Change the ODS with each dressing change at least once every 7 days. The frequency of dressing changes should be in accordance with clinical best practice and the dressing manufacturer's guidance. For disposal, treat the used ODS as biomedical waste.